Hi, this is Dr. Burns. Thank you so much for tuning in. While my PhD is in counselor education and supervision, and I train master's and doctoral level counselor education students to become clinical mental health counselors, this video is for all of you in your psychology, social work, or marriage, couple, and family programs. So the resources that I have and what I'll be talking about, it's for all of you. And I'm sure many of you are extremely distressed and troubled by how the changes in Blue Cross Blue Shield of Michigan's PPO covering private practices will mean for you in terms of being able to get practicums, being able to get internships, and being able to complete your hours after you've graduated and you're working towards your independent license. So I've got a ton of information for you. Now, if you happen to already hear my video that I previously created for individuals who are current Blue Cross Blue Shield of Michigan PPO subscribers about advocating against this policy, there's going to be a series of slides that will come after this that you've already heard. You've already listened to that. So if that's the case, then you want to go ahead and just fast forward to the first slide that begins with 6 things you must do, because there's different things that you do if you're a Blue Cross Blue Shield of Michigan PPO subscriber. There's things that you can do that no other group can do. And so that's on that video. Um, but a lot of the meat and potatoes about what exactly is happening, what's the ramifications of this. There are plenty of other alternatives that Blue Cross Blue Shield of Michigan could take. They do not have to go down this road and cause you this kind of panic and distress. So like I said, if you've already watched that other video, then you can skip to the 6 things that you must do. However, if you haven't listened to that video, you really need to understand what's going on and why. And then the resources that I've created for you and the suggestions that I'm going to make will make a lot more sense. Um, so kind of choose your path from this point forward in terms of how you continue on with this video, but I certainly hope that you will find it to be very, very helpful to you. So let's first clarify who's actually impacted right now. Blue Cross Blue Shield in Michigan has 2 different tracks. We need to distinguish the HMO side from the PPO side. And the Blue Care Network in Michigan is Blue Cross Blue Shield's HMO. And they historically have not covered services when treatment is provided by counselors, social workers, marriage and family therapists, and psychologists who have graduated and are working to become independently licensed in their profession. The folks who are impacted are those Blue Cross Blue Shield of Michigan members where they've got the PPO plan, the preferred provider option plan. And historically, the PPO plan has covered services when treatment is provided by counselors, social workers, marriage and family therapists, and psychologists who have completed their graduation requirements, and they're now working to gain that independent licensure. So, just to clarify, right now the change is occurring with Blue Cross Blue Shield of Michigan, the PPO customers. So let's talk about the difference between a PPO plan and an HMO plan. And if you're a Blue Cross Blue Shield member in Michigan, you really need to look at your insurance card to see if you're on the PPO plan or the HMO plan. But there's reasons why employers offer the various plans to their employees, and there's also reasons why then employees pick one plan over the other. So for the HMO plans, you've got to really go through a primary care physician to get any kind of treatment. And that primary care physician, you're going to have to go through them to see a specialist. HMO plans, there's no out-of-network coverage. HMO plans, there's extremely limited providers that you're allowed to see. But for that, your monthly premiums are a lot lower, your deductibles are lower. Administrative complexity is lower because everything's got to go through that HMO primary care physician. The care coordination is then highly coordinated. Again, for specialist access, you've got to get the referral from the PCP, and it saves the member, the individual choosing the HMO plan, a lot of money. It can also, save money for employers as well. But the alternative to that, and many individuals in Michigan choose the preferred provider option, because they don't have to go through their primary care physician to get treatment. They don't need a specialist referral from the primary care physician. Out of network coverage, you've got that option. And what that leads to is a lot more providers that you have to choose from. Now you pay for that because your monthly premiums are higher and your deductibles are higher. So you're paying for all of this. There's more administrative complexity because you don't have everything going through one primary care physician, and therefore the care coordination is less structured, but you have direct access to specialists and you've got a ton of flexibility. So you and your employer, if they are offering you the PPO plan, or if you had that option in another way, you've paid a good amount of money, and that's part of the contract between what Blue Cross Blue Shield of Michigan promised you as part of the PPO and what you've paid for. Okay, so what exactly has changed? Well, in very early June of 2026, suddenly Blue Cross Blue Shield of Michigan announced that they would no longer cover services for the PPO plan when treatment is provided by counselors, social workers, marriage, family therapists, and psychologists who are interns, meaning they're a part of it's a part of their graduate program in all of these professions to begin to have contact and directly work with clients, as well as individuals who have completely graduated and they're working towards independent licensure. That was done via something called incident to billing in private practice settings. And for those of you who don't kind of understand how this all works, individuals who are either interns or have graduated and are working towards their independent licensure, they must accrue hours under supervision so that they can become independently licensed. So what's been taken away is the idea that interns and individuals who have graduated and working towards independent licensure will no longer be able to be treatment providers through Blue Cross Blue Shield of Michigan's PPO system. So I don't want to bore you with too many details, but in all of these mental health professions, so the counselors, the marriage, couple, family therapists, the social workers, the psychologists, when you've got an individual who's in their graduate program or they've graduated and they're working towards that independent licensure, their supervisor not only provides guidance to that supervisee, but the supervisor also takes on legal and ethical responsibilities for the patient that the supervisee is seeing. So there's a direct connection between the supervisor and the patient through the supervisee. And so as such, it's been common practice for the supervisor to bill for the counseling services provided to the patient by the mental health practitioner working towards their independent licensure. And historically, this has occurred through Blue Cross Blue Shield of Michigan, the PPO side, via incident to billing. So why exactly does Blue Cross Blue Shield claim that they're doing this? Well, They say, one, it's to strengthen their ability to identify rendering providers. Two, it's to improve oversight of quality of care. And three, to ensure reimbursement is appropriately aligned with provider licensure and participation status with Blue Cross and BCN. And remember that BCN is going to be the HMO option for Blue Cross Blue Shield in Michigan. The problem and the reality is that Blue Cross Blue Shield of Michigan is going to drastically reduce the mental health treatment providers in Michigan. And, Blue Cross Blue Shield has created this quote unquote problem. Um, they could do several things and they would not have to reduce the number of mental health treatment providers in Michigan. So let's take these things point by point. One, Blue Cross Blue Shield claims it's to strengthen their ability to identify rendering providers. Well, currently, Blue Cross Blue Shield of Michigan is making the choice to not allow interns and limited licensed mental health practitioners to be paneled directly through Blue Cross Blue Shield of Michigan on the PPO plan side. Currently, all of those interns and those limited licensed mental health practitioners can apply for what's called an MPI number. And that is an identification number that links to one person directly. If Blue Cross Blue Shield of Michigan would allow these individuals to be directly paneled with Blue Cross Blue Shield of Michigan, then Blue Cross Blue Shield of Michigan would know exactly who was directly providing mental health treatment to the client. So there's a really easy solution there. So the reality is that Blue Cross Blue Shield of Michigan is willfully cutting off access to over 10,000 limited licensed mental health practitioners in Michigan. Okay, and let's look at point number 2 in their argument, that they want to improve oversight of quality of care. Blue Cross Blue Shield of Michigan claims that they'll do this by no longer allowing interns and individuals who have graduated and are working towards individual licensure to be reimbursed for doing that work in private practice settings. However, Blue Cross Blue Shield of Michigan does not determine how any of those professions, the counselors, marriage, couple, and family therapists, the social workers, and the psychologists, supervises its members working towards their independent licensure. That's set by the ethical codes for each of those professions, as well as Michigan state law rules and codes for all those professions, and then each one individually. So the reality is, even if Blue Cross Blue Shield of Michigan makes this change, all of the supervision requirements for a limited licensed professional counselor remain exactly the same if the supervisee works in a hospital or a private practice setting. So Blue Cross Blue Shield doesn't get to set these rules and regulations. So even if Blue Cross Blue Shield makes the change, the supervision requirements for each of those 4 professions, it doesn't change. What it does change is that there's far fewer places that you can get mental health treatment. And that for you means that you are going to have longer wait times to be treated, and you're going to have to travel a greater distance to receive that treatment if you're on Blue Cross Blue Shield of Michigan PPO plans. So ultimately, Blue Cross Blue Shield is willfully making it harder for rural and underserved populations to receive care, and for longer wait times for mental health treatment for everyone who's in a PPO plan in Michigan. Now let's deconstruct point number 3 in Blue Cross Blue Shield of Michigan's argument that they want to ensure reimbursement is appropriately aligned with provider licensure and participation status with Blue Cross, meaning the PPO and PCN. So once again, they keep aligning now their PPO being equitable with the HMO. So Blue Cross Blue Shield, what this comes down to is they don't want to pay the supervisor who has legal and ethical responsibilities for the patient that the supervisee is seeing. And that supervisor is also furthering the training of the supervisee through extensive consultation with the supervisee. So Blue Cross Blue Shield, they just want to pay the lowest rate possible that they can, and they want to make it harder for patients on the PPO plans to get a mental health counseling appointment. So here, Blue Cross Blue Shield is willfully cutting off the pipeline of licensed mental health practitioners that Michigan will have in the future. And Blue Cross Blue Shield is making some significantly flippant suggestions about how to negotiate all this. So they flippantly state that a private practice can convert to an outpatient psychiatric care facility if they want to bill for interns and graduates who are working towards independent licensure. However, per Blue Cross Blue Shield of Michigan's PPO requirements, in order for a private practice to convert to an OPCF, they must have on staff a board certified or board eligible psychologist or psychiatrist. And the problem is in 2026, we are currently in Michigan 880 psychiatrists short per NCHWA. And we've got many counties in Michigan that don't even have a psychiatrist in the entire county. So we don't have enough psychiatrists to go around to suddenly create more OPCFs. And then they also are required to have a psychologist on staff and a licensed master social worker on staff. And the problem is the majority of our private practices, whether it's psychiatry, counseling, psychology, counseling, social work, or marriage, couple, and family, many of them, you've just got a couple of providers, and it's not feasible for them to convert to this. And also to convert to this, that facility, they've got to spend 3 to 4 years so that they can be fully accredited by one of these bodies that are listed here. And that's just not financially feasible. In addition, those facilities have to have emergency services available on a 24-hour basis. The idea that we can convert in the state of Michigan with these 4 professions, all the private practices, to this type of an organization is honestly just laughable. The challenges, even for the Michigan Department of Health and Human Services, they themselves have said that they've tried to take some of their facilities and convert them into this type of a facility through Blue Cross Blue Shield of Michigan. But the problem is that Blue Cross Blue Shield kept moving the goalpost. So if even MDHHS can't convert some of their existing facilities into an OPCF, there's absolutely no way that a private practice with one of these 4 professions can convert to this. And even if they attempt to, the number of years just to even ramp up to what's being suggested, much less to wait 3 to 4 years to be fully accredited by one of these organizations, it's an impossible track to take. Additionally, Blue Cross Blue Shield of Michigan flippantly states that all interns and individuals who have graduated and are working towards their independent licensure can just go work at a hospital, an outpatient psychiatric care facility, or through MDHHS, one of their community mental health facilities. But let's take a look at how many providers, limited license providers we have in Michigan. And this is just the folks who have graduated and hold a limited license. That's currently 7,296 social workers, 2,471 counselors, 489 psychologists, and 144 marriage and family therapists. That's 10,400 people total. And that's not even talking about the folks who are doing practicums and internships that are inside of their graduate programs. That's not even counting them. Okay. And while some of those folks are working in hospitals or outpatient psychiatric care facilities or, community mental health facilities, in talking with MDHHS, they can't accommodate all of these people. So again, and this is actually the numbers that I'm quoting here. This is literally coming right now from the state of Michigan. Um, so this is also impossible. So what's really troubling here there are several ways that Blue Cross Blue Shield of Michigan on the PPO side could solve the quote unquote problem that they themselves have created and not reduce the number of mental health treatment providers. I'm just going to list a couple. There's more. But first, as I've mentioned, interns and limited licensed mental health practitioners can apply for an MPI number. And if Blue Cross Blue Shield would allow them to be paneled directly with them, then they could be billing directly, and then Blue Cross Blue Shield of Michigan would know exactly who is providing the mental health treatment to the client. However, if Blue Cross Blue Shield of Michigan takes this route, then they're going to force supervisors to directly charge their supervisees for supervision. And because then, if Blue Cross Blue Shield of Michigan takes this track, they'll pay the limited licensed provider much less money for seeing a client, but then they're going to force the supervisors to directly charge supervisees for supervision. So you're already going to have that supervisee getting less money, and then they're going to have to pay out of pocket for their own supervision. So it'll be a difficult hardship for the supervisee. And the reality is, even through the Blue Cross Blue Shield Michigan system, if we look at it nationally, Illinois is taking a very different track. They are recognizing that there is a shortage of mental health treatment providers. And so what they're allowing is for covered services rendered by the behavioral health trainee to be billed under a supervising licensed clinician's NPI number, that's the national provider number. Two, they require to do this that the supervising contracted provider must be available 100% of the time to that behavioral health trainee who's providing services, which would enable the supervisor to provide direction and intervene in the event of emergency. Number three, the supervisors may supervise a maximum of 4 trainees at a time. They stipulate that the supervisee must receive the required minimum individual face-to-face supervision in compliance with Illinois state licensure requirements specific to the trainee's level of licensure. So they are deferring, as they should, to Illinois state law for those professions. And they stipulate that supervisors and supervisees should work within the same organization or system. They, state that they might waive this if there's programs that are reaching underserved populations. And they have a rule that the supervisee doesn't make a direct payment to the supervisor for supervision while they're pursuing their clinical hours for state licensure. So, here we've got Blue Cross Blue Shield of Illinois recognizing the importance of that supervisory relationship, the ethical and legal and consulting responsibility of that supervisor to the supervisee. So, there's more examples out there than this, but there's a lot of other ways that Blue Cross Blue Shield of Michigan could be handling this, and it's very telling that they are not. So let's look a bit at Michigan mental health provider shortages. Per the National Center for Health Workforce Analysis, that's the NCHWA I was mentioning earlier, in Michigan in 2026, we already are short 2,170 mental health counselors and 1,410 psychologists. That's just now. So we're already at a deficit right here, right now. And we have Blue Cross Blue Shield of Michigan saying that, 10,000 people who are eligible to be treatment providers in the state of Michigan, and many of them who are working in private practice settings are no longer going to be eligible to see Blue Cross Blue Shield of Michigan's PPO patients. So that's gonna make this number feel larger. And the projections for Michigan in 2036 is that we will have a shortage of 4,070 mental health counselors and 3,820 psychologists. Sadly, these folks didn't have Michigan-specific data for social workers and marriage and family therapists. However, we are going to be seeing a shortage of those. So the challenge is if supervisors who are working in private practice settings aren't willing to take on supervisees, the entire pipeline of incoming counselors, social workers, marriage and family therapists, and psychologists just shuts down. If we look at NCHWA's numbers in terms of mental health care provider shortages across the entire US in 2038, you can see that we're going to be short almost 100,000 psychologists, 100,000 counselors, nearly 34,000 marriage, couple, and family therapists, and nearly 28,000 social workers. So we're already going into shortages. We currently have shortages. It's going to be pushed. They're predicting it's going to get even worse. But the problem is if the students don't see a pathway that they can get through their graduate school to be able to get internships sites and then be able to graduate and earn their hours while they can make some kind of a living until they can get independently licensed, these numbers are going to go up exponentially. So why did I say at the beginning that this is a breach of contract? If Blue Cross Blue Shield of Michigan, their PPO, if that's your plan, remember that you paid both more in premiums and deductibles so that you could access not having to coordinate everything through your primary care physician, not needing a referral to see a specialist, a greater number of providers, less structured care coordination, direct specialist access, and much higher overall flexibility to meet your healthcare needs. But what Blue Cross Blue Shield of Michigan PPO is now doing the same thing as their HMO with your mental health treatment providers. But the reality is you paid them for more access, not less. And that's where the breach of contract comes into play. All right, so what do you need to do to advocate against this change? So the first of the 6 things you must do is to contact your Michigan House of Representatives member and complain that Blue Cross Blue Shield of Michigan's PPO coverage is acting like HMO coverage and will cause thousands of Michigan interns and limited licensed mental health providers to lose their clients as well as their jobs. More specifically, you want to tell them if you are considering dropping out of your program, if an internship site is now unable to take you on as an intern, if you're concerned about meeting the requirements for graduation or independent licensure after graduation, or if clients won't be able to see you anymore and the impact that this will have on you and clients. So I've given you here the addresses to find your representative's information, and there's a host of resources for how to write your letter, what to say, and who to contact up on my website. So let's go over there and take a look. So this is the page that I'm linking you to. You're going to notice that there's a bunch of advocacy resources, and they're in a specific order. The biggest group that's impacted are all Blue Cross Blue Shield of Michigan's PPO subscribers, because there's a lot. They are by far, they almost have a monopoly in the state of Michigan when it comes to insurance, both HMO and PPO. So if you happen to be a Blue Cross Blue Shield of Michigan PPO subscriber, I'd really encourage you to watch. This video happens to be in 2 parts. The first thing is the general gist of what's going on, but then I created a second video that talks specifically through all of these advocacy resources. And so there's a 7-page document and a 2-page document outlining the content of those videos. And I give them different files and contact information. The thing that's a little different for them is they can contact, as a PPO subscriber, they can contact the Office of Consumer Services within the Michigan Department of Insurance and Financial Services. Why that's important is the DIFS is actually the ones that allow Michigan to sell health insurance in the state of Michigan. So if the DIFS isn't happy, Blue Cross Blue Shield of Michigan has to pay attention. Also, for Blue Cross Blue Shield of Michigan PPO subscribers, you can directly email and or fax a complaint directly to Blue Cross Blue Shield of Michigan about this. The next grouping are all the advocacy resources for folks who currently are Michigan limited licensed mental health professionals. There's also advocacy resources for Michigan fully licensed mental health professionals and or private practice owners. Your resources are down here under the advocacy resources for Michigan graduate mental health students. And you'll notice point 1 doesn't exist here yet. You'll see these elements by the time this video gets posted, but in order to post those things, I have to have the actual link for the for this video, which I'm creating right now, so I can't really do that. But it will look an awful lot like what's here, where under point 1, it'll link to this video that I've created. And you will then see for you guys your own 7-page and 2-page document that outlines the content of this video. So you can have that. What I do have already up there for you right now is under point 2, there's an RTF file. The reason it's an RTF file is because it can be used by Macs, it can be used by Windows or PC or Android environments, and it can be pulled into things like Google Docs, and just any word processing program can take an RTF file, so it's just easy for you to use. But I give you an RTF file that gives you the substance already and what you need to include to write your Michigan representative and your Michigan senator. I also here for you have a link to find your Michigan representative. I also have, because if you've got to type in your address to know which representative is yours. And then I also have included an Excel file that contains the address and contact information, meaning emails, phone numbers, where their office is actually located, the mailing address, all that stuff for all the Michigan representatives. So you can download that there if you'd like. If you click this link about finding your Michigan House representative, you'll notice that if you scroll down on that page to the right, you just plug in your street address, you hit submit, it'll tell you who is your representative. The example that I'm going to show you is with Matt Hall, as if Matt Hall was the representative. So I'll come back to this in a minute. But let's talk. If you were to download this template that I've created for you about contacting either your representative or your senator, what's in here? So text in red are things that you just absolutely have to attend to. You've got to change that to make it yours. And text in green are just points to consider. With all of this, please feel free to change it. It's just to give you some quick ideas about what you will say if you write, you call, or you email. Phone calls do matter more than emails, but if the only thing that you feel comfortable doing is emailing, then just email. You can email, write, and call. Living in the district of the legislator does make a bigger impact. You're going to notice when I start off this letter, I'll begin by ensuring that the person who reads it, and if it happens to be passed along to the representative or the senator, that I know who they are and the leadership roles that they hold. So it's important that we do this if we want individuals to listen to us. A lot of times staffers see these things first, but no matter what, it's an important thing for us to consider. The next thing I do is thank the legislator for taking action on at least one, if you can do it, two or three issues that you appreciate that they have done that have protected Michigan citizens. We're all human, and it doesn't matter if you feel affiliated with the party that the person is representing. There's always going to be things that you will appreciate more about what that legislator is doing than other things. So don't talk about those things that you're not appreciating. We have an ask that we're trying to do, and this is not the time for that. What you want to do is figure out things that you do appreciate that they're focusing on and working towards, and call that to their attention. It goes a long way if you want them to take your ask seriously. And then I follow up by asking them to take action on what's occurring with Blue Cross Blue Shield of Michigan's PPO. So you can see here that you begin with your name. You may not have any credentials at this point, so if that's the case, don't worry about that. You want to put in your address, your phone, and your email. It helps them understand if you really do live in their district, or often the staffers will respond back to you, even if it's just to say, we got your message. And they want to be able to contact you to do that. So it's polite and important to do these things. You want to date it. Now, I had talked to you about writing as if this was going to Matt Hall. He happens to be the Speaker of the House right now, so it's addressed as House Speaker Matt Hall. If, however, your representative is not Matt Hall, you can't begin it with Dear House Speaker. You would instead change that to something more like Dear Representative Hall, if he wasn't the House Speaker. So you can see I begin the first thing. Thank you so very much for protecting the citizens of Michigan as a state representative and as a Speaker of the House. And I have stated, I appreciate that you've worked tirelessly to make life more affordable for Michiganders, to provide value for taxpayer dollars, and to restore trust in government. Where did I get that from? If we go back to this representative's webpage, the recent posts often tell you what that legislator is up to, so you can find things there. Sometimes in the about areas, you'll find them talking about what it is that they focus on. But in general, you want to look on their page to, and it's better to talk about things that they've been working on more recently if you can find those. So that's where you're going to get that information. The next thing, as your constituent, and say, if you're not a graduate student, maybe you're an undergrad, state the university that you're at and what your program is. And you're asking them to also agree to protect Michigan citizens by intervening to stop Blue Cross Blue Shield of Michigan's proposed changes. Now I've got some areas in green here. These are just things to get you started to think about. You need to seriously edit this to speak to exactly why are you going into your counseling, social work, psychology, or marriage, couple, and family program, and why did you choose this particular profession? And talk about why you're concerned. Especially if you're in a graduate program, you have extensive practicum and internship experiences that you've got to do. The placements aren't optional. So you want to help them understand that. And helping them to understand what will happen if you can't get internship placements. If you manage to do that, graduate, but you can't get a job while you have your limited license, you need to let them know about that. Now, your degree program is leading to a particular license. I've put that in red. You want to change that to the license that you're aiming for when you get your independent license. And talking about, what it takes to gain those hours that you're required to do. The idea of removing private practice as a major training environment places the future of the entire behavioral health workforce at risk, and that there's practical alternatives to this, and they aren't doing it. You're already in a program you've already put in a certain number of years of education. Maybe you're already in internship at this point in time and you've had supervised clinical training. And how frustrating it is to now suddenly see that an insurance company, not university requirements or licensing board requirements or Michigan law, impacting your ability to complete your internship, graduate, begin your career. And that this is coming at a bad time because we really need more mental health providers, not fewer. What comes in black are key points that I've talked about earlier in this video about what Blue Cross Blue Shield of Michigan is claiming and how that doesn't work, and how their strategies, the number of people impacted, and how their strategies just don't work, and there's other alternatives. Again, from start to finish, heavily edit this, but I've given you at least some food for thought prompts so that it'll be a lot easier for you to decide what it is you're going to say when you call, when you email, and when you write. So I hope that you'll find all those resources for contacting your Michigan representative to be extremely helpful to you. So the second thing to do is to contact your Michigan senator. You have one of those, and you're going to complain about the same thing. So you can use the same letter. You're going to adjust the beginning of it for your particular senator. You can find your Michigan senator at this link, and you can use that same template to write to the Michigan senator or representative. You can see I've got a link here to find your senator, as well as an Excel file that contains the mailing address, the phone number, email for all Michigan senators. You can download that here. So, just like before, when you get to this site, you'll just type in your address and it'll identify who your Michigan senator is. So I hope all those resources will help you when you contact your Michigan senator. So the third thing that you need to do if you're in a training program for counseling, social work, psychology, or marriage, couple, and family therapy is to actually contact the entire Michigan House Health Policy Committee. And you're going to be complaining about all the same things. So the good news is, you can use the same letter that you've written previously. It'll just be reformatted, the beginning of it, for these folks. So why the Michigan House Health Policy Committee? This committee is concerned with the number of behavioral mental health treatment providers that exist in the state of Michigan. So this issue is near and dear to their hearts, and they can apply a lot of leverage with Blue Cross Blue Shield of Michigan to help advocate to change this policy. So I've given you at the link listed here how you can find out who's on that committee. It's also up on my website, as well as the beginning template letter for this particular committee. So let's hop over to my website, and under point 3 is in your section is where you'll find the RTF file to help you call, write, the Michigan House Health Policy Committee. There's also a link that you can click to go there quickly, and that's right here. That page will pop up. There are a lot of representatives on this committee, so there's the 3 leaders as well as all of these members. And if you're saying to yourself, I refuse to email all those and call all those people, okay, fine. If you're only going to do a few, then email, call, write the leadership here. And you do this even if they're not your legislator, because these folks are on the Health Policy Committee. They, like I said, they're charged with caring about this issue, so they're the ones to contact. If you go back to my that RTF file, here's what you'll download. And you're going to see here that I've just done this as if this is being written to the actual chair, Chair Vanderwall. And so you can see that I thank him for protecting the citizens of Michigan as the Michigan House Health Policy Committee chair. And I have gone to his personal page on the House of Representatives, and I have found a few things that I appreciate that he has done recently to help the citizens of Michigan. Obviously, you can change that to fit you. And then from here forward, really, you can be using the same information that you used before. If we go back and we look, you'll change the greeting from chair to majority vice chair for Representative Thompson, and for Whitwer, you would change the beginning of that greeting to minority vice chair. And then, you would just address the members of Dear Health Policy Committee member and use their last name. So hopefully this will help you as you craft what you'd like to communicate to the Health Policy Committee members. The 4th thing to do is to contact the entire Michigan Senate Finance, Insurance, and Consumer Protection Committee. And you're going to complain about all the same things. You can see I've got, it's a pretty long address to try to get to the list of folks that are on this particular committee, but there it is. And that's also on my website. That's an easier one to just click the link for. And so why would we want to contact the FICPC? Well, they actually are the ones who oversee the department that allows Blue Cross Blue Shield of Michigan to sell their health care insurance in the state of Michigan. So they have oversight into the department that runs and regulates Blue Cross Blue Shield of Michigan. So these folks have a lot of power and can do a lot for us. And they would care about the concerns that we have, which is why it makes it advantageous to us to go ahead and advocate to them. So once again, under point 4, you'll find the template for the Michigan Senate Finance, Insurance, and Consumer Protections Committee. And then right below that is the link that will take you here to the webpage that actually lists everybody who's on this committee. And because it's the Senate, there's far fewer senators than there are House members. And so we have fewer committee members on here. I would once again encourage you to call, communicate, write to all of them. But if you are only going to do this with a few of them, then it should be the chair, the vice, or the majority vice chair and the minority vice chair. So once again, a lot of this is similar to other letters, but I begin the greeting. And in this example, I'm greeting the chair of the committee, Chair Kavanaugh, and I thank her for protecting the citizens of Michigan as chair of that committee. And I have found a few things that she's been working on that I appreciate. Of course, there's other things. Feel free to look at her personal page and amend that accordingly. And then you'll just move on from there with what you've already written. But this will give you a nice beginning to get you started when you're writing this Senate committee. The fifth thing to do is to contact Michigan's Governor Gretchen Whitmer and complain about all of this. You can see the webpage where you can do that. And I've got some templates for you as well. So on my website under point 5, you can see that RTF file that I'll just show you in a minute to download. And you can click that link to take you directly to the page to contact the governor. So it's going to seem very similar. We're going to begin by making sure that we start by saying that we know something about the governor, what she's been doing. We're going to thank her for taking action on some specific issue or issues that we appreciate. And then we're going to ask her to take action. So, so Governor Whitmer, thank you for protecting the citizens of Michigan as governor. And I found a few things that I appreciated that she's done. Those things might not speak to you. You can certainly go up to her webpage and you can find the things that she's been talking about and working on recently and pick 1, 2, or 3 items that you can say thank you for. And then you'll just continue on with your letter. And lastly, talk about this on social media. You just have to be mindful about protecting your own personal privacy as well as the privacy, if you happen to be seeing clients in any way, shape, or form, you can't be disclosing things that folks could in any way, shape, or form figure out who it is that you're talking about. So complain about all of these things because all this complaining and all these various outlets, it applies pressure to Blue Cross Blue Shield of Michigan and it makes them look bad. Now, they've chosen to make themselves look bad, but staying silent isn't going to help us move the needle in a more productive direction. And so that really wraps things up. We've talked about what it is that you're going to want to be saying, and especially for you being a student in a counseling, social work, psychology, marriage, couple, and family program, what that means to you and what that's doing to yourself and your other colleagues in graduate student programs as well. So I hope I've given you a lot of tools that you can use and a lot of things to think about when you're thinking about what you want to say to our legislators as well as the community at large about what these potential changes might mean for you. So I hope that this has been really helpful to you. Take care, advocate, change can happen, hang in there, and have a great day.